Hey everyone, welcome to the Inflammation Nation podcast. I'm your host, Dr. Steve Noseworthy. The views and opinions expressed by my guests in this podcast are not necessarily consistent with my own views and opinions. However, I do my best to be respectful of their views and opinions as they express them, even if they differ from my own. Now let's get to the podcast. Hey guys. Sometimes I interview guests who have something of value to say to both healthcare consumers and healthcare practitioners alike. So this is a joint episode for both the Inflammation Nation and the FuncMed Nation podcast, and it's going to appear on both platforms. Nate Jones, who's my guest today, is the founder and president of a company called Xlear, and that's spelled Xlear. And they're a US-based company that sells xylitol-based nasal sprays, rinses, toothpastes, mints, and so on. And Nate's father, who's a retired old-school rural medical doctor, started crafting his own xylitol solutions in his medical practice years ago as a way to control and resolve recurrent ear infections in the kids that were under his care. And this was so successful that later, Nate and some friends founded Xlear Inc. in 2000, and they brought his father's novel approach to market as a commercial product in the very first ever xylitol saline nasal spray. Today, Xlear Inc. remains a leader in xylitol-based nasal and oral hygiene products, with products on shelves of major retailers like CVS, Walgreens, and Sprouts. Their products are also sold on Amazon. In fact, I believe they're the number one nasal spray sold on Amazon, as well as on their own website, which is xlear.com. And again, that's Xlear. Now, Nate and his team have graciously agreed to offer you, my listeners, a 20% discount on any of their products sold on their website. Again, that website is xlear.com, Xlear.com. And the coupon code is DRN for Dr. N, DRN20. Now, this is good for 3 months from when we publish the episode, which should bring us roughly through towards the end of January 2025. So act on that now. That's xlear.com with an X, and the coupon code is DRN20, and I'll pop that into the episode description. So I actually have two podcasts, Nate, and depending on the tone of the conversation, I might post this on both. The first podcast is called Inflammation Nation. It's for the public. I've been doing that for several years now. And that's just lay people, although I do have a lot of practitioners that follow me on that one. But last year I started one that's exclusively for practitioners called FuncMed Nation. And that's where I talk to researchers and PhDs and people who run labs and companies like you, just to have more of a clinical conversation. So I think that ideally we'd have a little bit of both. Like I've seen some of the interviews that you've done, and it seems like you know enough of the science behind some of the stuff that we could have, let's say, a scientific rather than a clinical discussion. But I would like to start more with the things that are applicable to the general public, and talk about xylitol, its history, your dad, the company. I'm sure you've talked about that so many different times. But then I'd like to talk about, some of the research that's been done. I know there are many, many different papers. So again, I don't have anything specific. I've got just a rough outline just to keep myself on point and on task. But I'd like the conversation to go anywhere it needs to go. So I'm going to throw the question back to you. Is there anything that you want to make sure that we cover just from your perspective?
From my perspective, I don't want to be too pessimistic, but I want to make sure that everybody knows that they should never trust their public health agencies for health. But I think you're probably agreeing with that.
Oh, we can talk about that. Yeah, absolutely.
I mean, I probably should just tell you this when we are recording. I've never had an issue with government agencies until they sued me. Mm. And that's absolutely absurd, because I've been in business for 21 years and never had an issue with the government. Yeah. And for the government to come and sue me because I was sharing data, published research studies and sharing guidance that was actually on the CDC's webpage.
Hmm.
Absolutely kills me. And there's a lot of people in this country that despise our government. I was not one of them until the government sued me. But
What were
now
they
I can.
suing you? Like what specifically? And let's just consider we're rolling now. The episode is going. So why don't we start with this big picture stuff? Because this is unfortunately it's a sign of the times. Not that it's a recent development, right? Because these governmental agencies have been messing around with what we're allowed to say, what we're allowed to record, what we're allowed to prescribe from a natural perspective. We have a very well established history in natural medicine of natural compounds that we've used for decades, all of a sudden being reclassified as medications, and the only people who can prescribe them are licensed medical doctors with a DEA number. So let's back up just a little bit, and let me ask you point blank, what did they sue you for? What was the issue?
Well, they're claiming what they sued us for is that we were making false and misleading statements about nasal sprays and their effect on COVID.
Oh.
And there's plenty of data. And in fact, the best example of this is even prior. So coronaviruses are not new. I mean, we've had coronavirus infection, respiratory coronavirus infections for, I don't know, thousands of years, millions of years, forever. And on the CDC's webpage, prior to 2020, on the CDC's webpage, they had that the way to treat a respiratory coronavirus infection was using salt water to physically, saline irrigations, putting salt water up your nose, whether you're using a neti pot, an irrigation bottle, or a saline spray, because what you're doing is physically reducing the viral load in your nose. Okay, so this was the CDC's guidance on how to treat a respiratory coronavirus infection, okay, in 2020. And when COVID came, one of the very first studies that came out was a study that was done, funded by the NIH. It was done at Vanderbilt University, and they took 60 people over the age of 65. All of them had COVID, all of them tested positive, and they gave them salt water. And in under a week, 100% of them were better, okay? The companies in the industry started sharing that data, and the FTC, the Federal Trade Commission, sent warning letters to us not to share it. Tell me how that makes sense. And NeilMed and Navage backed out and said, okay, we won't share that data. And I said, no, you have people that need this data, and we're going to continue to share it. It's our right. It's public. It's in the public domain.
Yeah, and not only that, it was published, I would imagine, in peer-reviewed literature, which according to all these agencies, would be the gold standard, right? Everyone's looking for peer-reviewed literature, randomized, double-blind, placebo-controlled studies, right?
Correct.
But even when things like that don't agree with the tone of the environment, then they get discounted or labeled as things like misinformation, right?
Correct. But it worked exactly as what you would have thought. What hundreds and thousands of years of history have taught us is that washing the upper airway for a respiratory pathogen that enters in our upper airway was effective. Yeah. And we knew shortly after that even you could put a wide variety of products into that nasal spray, nasal irrigation product that made it more effective. We have been utilizing xylitol, which, if people aren't familiar with xylitol, it's a natural sugar. It's a 5-carbon sugar. And we've known since the 1990s, that xylitol blocks the ability of bacteria to adhere to tissue. Okay, and if you can block a pathogen from adhering to your tissue, obviously you use that, you're not going to get sick as often because you're blocking the pathogen's ability to enter the tissue, the system.
Right.
Um, and that's what the whole premise of our company, Xlear, was based on. And my dad was a physician, and he started using it in 1998 because he had read dental studies where kids chewed gum with xylitol and they got 40% fewer respiratory infections. So, but anyway, that's where it started. And we knew in early 2021 that utilizing a nasal spray with xylitol or using a nasal spray with iota-carrageenan on a daily basis reduced transmission of COVID by anywhere from 70 to 80%.
And it was that,
And then,
are these published like your own studies or other groups
no,
studying that?
these are actually other studies, but in early 2020, there was a study that came out of University of Tennessee where they showed that xylitol and iota-carrageenan block the ability of the SARS-CoV-2 virus to adhere to tissue. We, in June of 2020, went to the FDA and said, hey, we would like to do a study. We had a doctor, a pulmonologist that was treating COVID patients in Miami who was willing to do the study. He was already using it in his practice. So he goes, yeah, I'll do the study. We weren't asking for money. We were asking, yes, can we go do a study with COVID patients? And the FDA wouldn't allow us to do it because our product is not a drug, and they would not allow a cosmetic they wouldn't allow a non-pharmaceutical product to do a drug action study on whatever class pathogen they considered COVID to be.
Right.
And so we didn't do one, but they did one in Argentina using the iota-carrageenan because there's a company in Argentina that sells an iota-carrageenan nasal spray. They did the study there. They had a 79.8% reduction in transmission of COVID in hospital workers. Okay. A company in the UK went and made a nasal spray with xylitol, very similar to ours, and they went and tested it in India, and they used it 3 times a day, and they used half as much xylitol as we did, but it still reduced transmission by 62% above and beyond what the saline did, which we know saline already reduces it by 15 to 20%.
And was that the only impact, was the reduced transmission, or did it change uh, the viral efficacy? Like, did it reduce symptoms or reduce the length of illness or complication?
Well, if it prevented, I don't know. Well, what I do know, I'd have to go back and look at that. But what I do know is that in all of the studies that I've seen where they used any nasally applied product, there were 0 hospitalizations and 0 people dying.
Yeah.
I mean, COVID is not a hard pathogen to kill. It's that our public health agencies told us to do the one thing that made it bad, which was don't do anything at all, sit at home until you get really sick, and then go see a doctor.
And then go see some. Yeah.
But I've had this discussion with quite a number of physicians that were treating COVID. And when you really think about it, COVID is the SARS-CoV-2 virus is not a strong virus. The rhinovirus is a much stronger virus because you can use practically anything. I mean, they've done studies with baby shampoo, with iodine, with nitric oxide, with xylitol, with iota-carrageenan. Every single one of these, even they did one at the Cleveland Clinic with what's in fluticasone. They did one with fluticasone, and all of these had a good effect at getting rid of COVID. They did one with azelastine, which is just an antihistamine.
Yeah, and my experience in my practice, I've certainly worked with people who either acquired a coronavirus infection or had it when they just happened to reach out to me. But I don't put myself out there as someone who treats COVID or coronavirus or any of those things. But in many cases or in many ways, a virus is a virus is a virus, and there are almost like repeatable and reproducible ways to either inhibit viral replication or to decrease the absorption, or I should say the adsorption and the adherence, which I know that these are at least some of the mechanisms of xylitol. I can tell that this is like it's a passion point for you. So let me ask you this question, and we can come back to this topic because I think that it's probably something a lot of people want to hear more about. But um, what is the status of this court case now? Are you guys in legal battles right now, or has this
Oh
been
yeah,
resolved?
no. We're in a court case. They just finished the depositions, the fact discovery, last 2 weeks ago. September, the end of September was the end of fact discovery. And, it's going forward. I mean, the stuff that we've learned, it just shows such incompetence on the level of the people in our government that were managing this, that it's a criminal negligence is really what it was.
Yeah.
What we learned is that the lawyers at the FTC, when they saw that we were trying to share these studies, they sent us a warning letter without ever having read the studies. They acknowledged and they told us that they did it because it wasn't in the news, and if it wasn't true, and if it was true, it would have had to have been in
It
the
would have been
news.
in the news. Yeah.
That's what they said.
So in that, basically what they're saying or suggesting is that the litmus test of accurate information is whether or not mainstream media is covering
That's exactly what they said.
it. And for the average North American, that concept is not going to fly, right?
Well, one of the other things that we learned, you would think that when someone finally did open and read a study, that they would have said, well, it's on the CDC's webpage. Maybe we should let them have a go. Maybe we should let them, let it slide. But
Yeah.
the government doesn't know how to admit that they're wrong.
Mm.
And I'll give you a good example. When we were doing the depositions, we talked to one of the lawyers at the FTC. We said, how long have you been at the FTC? 21 years. In 21 years, how many times has the government, as your agency, sent a warning letter to a company or an entity, and that company or entity responds with data, and you guys said, oh, yeah, you're right, we're wrong. And you take back that warning letter and you publicly rescind that warning letter. How many times do you think that has happened?
I would imagine zero.
Zero. So our government agencies are so cracked that they are batting 1,000 for 21 years, or they're just corrupt.
Yeah.
That's the only way to look at it.
Yeah. Yeah. So is the end in sight, and ultimately what's at stake? Like if they come back and say, no, we're right and you're wrong, are they going to, well, what are they threatening to do? Is it just heavy fines? Is it regulation on sales? Is it distribution? Is it, we're going to
They haven't come back
reclassify
with
this
any of that.
So they haven't. So they're just saying, we don't like what you're saying. But ultimately the consequence, if you lose that battle, is yet to be determined.
Correct. But let me explain a little bit more why our court case actually really matters to pretty much everybody in America.
Yeah.
Not everybody, but 80% of the people that take supplements.
Yep.
Okay, or 80 or whatever percentage of the American population uses natural products or herbs or supplements or anything of that nature. And the reason why it matters is because the FTC, the Federal Trade Commission, their job when they were tasked by Congress to, when they were given their charter, was to make sure that companies and entities did not make false and misleading statements about what they were selling when they had interstate commerce. Okay? That's what their charter was. And it stayed that way until the 1970s. And in the 1970s, they came up with what's called the Pfizer factors. And the Pfizer factors were guidelines that the FTC started using. So if someone had already committed a crime, if I had been accused and they had shown that I had lied and cheated customers, then they would be able to utilize these Pfizer factors to fence me in, and that holds me to a higher bar than your average person that has never committed a crime.
Right.
The courts allowed that only for these people who had previously committed a crime. within a couple of years, the FTC was pretty much putting those out for everybody. Hmm. And the courts and Congress didn't rein them in. And pretty soon, in 1990s, when the SHA, the Dietary Supplement and Health Education Act, came out, the FTC soon after that came out and said, hey, with this new thing, with all this new health category and herbs and everything and supplements, you need to have at least some studies backing up the claims you're making. And that was in 1998. People went along with it. The government went along with it. And the courts went along with it. Well, so those were the guidelines that we were working under for the entire existence of the company. Xlear. We started the company in 2000. It was after that. We understood those rules. We never made a claim that wasn't substantiated. When COVID came, the FTC came and said, no, our new rules are you have to have 2 RCT studies for each and every SKU, each and every product that you put on the market. And we said, show us where your rules say that. And lo and behold, a year and a half after they sued us, their new rules came out in December of 2022, where they said, you have to have 2 RCT studies for each and every product you put on the market.
And they were applying that retroactively.
Yes, that's exactly what they did.
Because I remember, like there was recently there was a Supreme Court case. I want to say with the last Lopers. That's the one where the
Chevron deference.
That's exactly right. The Chevron deference. And are you
correct?
Guys, well, can you, for anybody who's listening who doesn't understand the importance of that and how it might apply to you, can you just review the details or the outline of that just so that they have some context?
So, and I was going to go there anyways, because so the Chevron deference was implemented in 1984, and in that the Supreme Court, because Congress had abdicated their job to actually give guidance, the courts gave the ability to the agencies to interpret the laws as they saw fit. Okay? That's why the FTC can come out and say, well, the law that we're upholding is making false and misleading statements. Now you have to have substantiation. Now you have to have 2 RCTs. And the stupidity of that is that you can have 2 RCTs and still have fake data. It happens all the time.
Yes.
So false and misleading is not, does not, just because you have 2 RCTs doesn't mean you're making false and misleading statements. So when last summer, it was the end of June, the Supreme Court overturned that. They threw it out and said, no, the agencies don't have the expertise. And they argue, and so I should actually go back. The courts in 1984 said the agencies have the expertise to interpret those laws as they see fit. Well, the agencies in our government have given us COVID. They've given us AIDS. They've given us everything. I mean, they've given us the sickest country on the planet. So the agencies, the government agencies, they don't have the experts. I mean, the government agencies didn't even open the studies and read them, probably because they thought they wouldn't understand them. I don't know why they didn't. But they obviously don't have the expert. And so I think that overturning the Chevron deference, I think that was the best thing the courts could have done.
Right.
But what that now means and why it means that our case is important is because our case is the first one slated to be tried in a court without the judge deferring to the agency to interpret the law however they see fit.
Right. So that's a huge advantage for you guys in that battle.
Correct. And when we started this, when we made a conscious decision that we were going to have the government sue us, our goal was to actually take out part. We didn't think we'd completely gut it. We wanted to push back on that Chevron deference. That was our goal. Now that's gone. And now we actually want to push back further to where the FTC can't come out and randomly sue people, unless they have a case, unless they have proof that someone is saying something that's false or misleading. because the
Right.
way that they're doing it now is they sue you and you're guilty and you're going to spend millions of dollars proving you're innocent, but it's that you're guilty until you're proven innocent.
Yeah. Yeah. And that's a travesty of justice. That's for sure. How did you get on the radar? Because someone, I can't imagine that there's someone sitting in an office at the FTC trolling around the internet reading your claims. It's almost like somebody would have to say, "Hey, did you see what these guys are doing and what they're saying about their products?"
You know what? We have asked how we got on their radar, and they have not told us. They're
Mm,
supposed to have given us all of these documents showing how we got on their radar, but yet the very first time there's a mention of Xlear in any of their internal documents was the warning letter. So that warning letter was drafted and appeared out of nowhere. And there's no phone records, there's no text message, there's no telegram, there's no email of these people, and they're all working remote, where they were discussing what this
mm.
was.
Is there a name attached to that letter?
There's three names actually. There's
And
Richard Cleland, who was the head guy that was supposed to be investigating and was too lazy to open and read a study. There's a Michael, what's his last name? Michael something, and then there's a Serena Viswanathan, who was their boss.
mm, so
But
not
Richard,
necessarily the people who actually initially raised you guys as a potential red flag.
well, again, that's a good question. We would like to
Yeah.
know the answer to that. We would like to know how it came up on their radar. But they haven't given us, and they're supposed to have, but they haven't given us all that. They said it doesn't exist.
So in the meantime, while all this is going on, are there any restrictions? Are you still allowed to produce and distribute and sell the Clear
Oh
product?
yeah, yeah, yeah.
Yeah. Well, let me
They're
just get
not they haven't shown any harm. They
right.
haven't shown a single incidence of anybody being harmed. And if they had, they could go out there and say, yeah, you got to take it off the market until that's proven. But they don't. They haven't given us a single example of a false or a misleading statement that
Right.
we've made either.
Right. Or haven't definitively proven that there's no data behind any of the claims that you make. Right. Because
Correct.
clearly, like xylitol is just as a generic ingredient has been studied, as you mentioned, initially in the dental field. Um, and it's been studied, as you mentioned, not just in the States, but also international.
Oh, it's been studied all over the world.
Yeah.
I mean, and xylitol. The interesting thing, if you want to look at it historically, if you go back even a couple of hundred years, xylitol was more than likely the number one sugar that was consumed by humans.
Hmm.
Today, we most of the sugars we eat are six carbon sugars: sucrose,
Hmm.
glucose, fructose, sorbitol, mannitol, maltitol. But if you go back 100 years, or not 100, maybe 200, 300 years before we started refining sugar, where we got it naturally when we eat fruit, when we eat vegetables, when we eat any plant matter, xylose is the most common sugar on the planet.
Hmm.
And it was much more part of our diet 200 years ago than it is today. And there's a doctor out there. His name's Mark Cannon. He's a pediatric dentist, but he does a lot of research. He's doing research with autism. He's doing research with cancer. But he actually lectures on this and points out that the xylitol that we're getting, really all it's doing is shifting our microbiome back to closer to what it was 200 years ago.
I think that, like from an epidemiological perspective, you can go back and look at the either the appearance or the acceleration of different disease states and see how the agricultural revolution and then the industrial revolution and then maybe we could call it the pharmaceutical revolution, progressively brought us to where we are today, which is unexpected rates of chronic disease across all ages. Like I've been practicing long enough that I can truthfully say that there are more sick people who are more sick across all age brackets than when I first started practicing back in the early to mid 90s. Right, the my
100%.
environment, and yeah, my practice has changed. The nature of the conditions, which in one hand, speaks a lot about, like, the human genome hasn't changed in that time frame. What has changed, perhaps the environment, certainly our diets, certainly our lifestyles. Um, so why don't we use this as a way to pivot back to just kind of the bigger picture? You just defined what xylitol is. It's a sugar molecule. It's a naturally occurring sugar molecule. Um, if you'll indulge me just for a second, just kind of want to set the framework for anybody who's listening, or if they're watching on YouTube. The core ingredient of your products, and you have more than one product, is xylitol. That original research was in dentistry with, I think it was with tooth decay, but they noticed that kids that were using that also got fewer respiratory infections. Um, but as with many things that are in the natural world, research and time reveals different applications, um, different ways to use these products or these ingredients. I mentioned, before the the official part of the podcast started, that I've used your products, particularly the nasal spray, in select cases for probably the last 15 years with great success. Like most of the people with recurrent sinus infections. And
Yeah.
I've used your products personally. Like not so much since COVID, but I've done a lot of traveling in my seminar lecture part of my career. In fact, I'm getting ready to fly from Eastern Canada, which is where I am right now, to California in a few weeks to teach a weekend seminar on brain chemistry. And I'm going to be exposed to a lot of people in multiple airports and on the airplanes for 3 or 5 or 6 hours at a time. And you better believe I'm going to be using the Xlear products to protect my nasal and respiratory environments. So having said that, you've defined what xylitol is. Tell us where you get it from, and then tell us a little bit about how it's effective in protecting the nasal and respiratory environments, and talk as much scientifically as you want to about some of the mechanisms that xylitol has that prevents infections either from spreading or from multiplying, dividing.
Okay. Can I put a pin in that and come back
Absolutely.
to it in just a second? And the
Sure.
only reason why I'm asking this is because you started talking about the dental field,
Yeah.
and that is where xylitol got its start. And what they were doing is looking at how it was preventing tooth decay. And what they noticed was kids that chewed gum in these studies, not the ones that chewed the sugared or the sugar-free gum, but only the ones that chewed the xylitol gum were getting 42% fewer respiratory infections just by chewing gum. Okay. Um, and then there was a study published in the Journal of Antimicrobial Chemotherapy in 1998 where they showed that xylitol blocked the ability of strep, pneumo, H, flu, MCAT, those pathogens, the most common pathogens in the nose, along with staph.
Yeah.
But it blocked those bacteria from adhering to the tissue. And so you can make the leap right there and say if it blocks it from adhering, you're going to get fewer respiratory infections.
Right.
Okay, that's what the data tells you. Um, and but some of the other stuff that comes in from that, and I don't know if that hit the news up there in Canada. How's Canada on water fluoridation?
Well, I've lived in the states now. I'm up here for the summer visiting my dad. So
Oh, okay.
I live and practice in the states and have since the '90s. But yeah, all the water is fluoridated.
Okay. So just I want to say in the last 2 weeks, a court in California, a very liberal state, actually passed down a ruling saying that the EPA had to go back and visit the whole concept of water fluoridation because
Mm.
they had data that came out and showed that water fluoridation only reduces tooth decay. Okay. Do you want to take a guess on what that paper said? And this was a Cochrane review. You know who the
You
Cochrane
mean in
group is?
terms of like what percent reduction?
Yeah.
I'm going to lowball it and say less than 15%.
4%. And the reason why the court came out and said the EPA needs to do that is because 4% reduction in tooth decay doesn't compensate for the drop in the IQ that we know happens. It doesn't count for all of the other systemic osteoporosis, all of the other systemic issues that come from putting fluoride in the water.
Right.
And the studies from the 1960s and 70s, where they justified putting fluoride in the water, showed a much higher reduction, like 20 to 30. Okay. So the question is why did it go from 20 to 30 down to 4%?
Well, I would imagine either because data was falsified or it was a trick of statistics.
I'm not going to argue that the data wasn't falsified at all, but I'm also going to tell you, you already gave me the answer. And it's the change in our environment. Because back in the 70s, you ate 3 squares a day. You weren't snacking all day. Okay? Fluoride does not work unless the pH of your mouth is above 5.7. But if you're eating all day, you keep the pH of your mouth under that.
Meaning, and translate that for those who might not be scientifically minded, that means higher acidity.
Yes, sorry. Yes, if you keep your mouth more basic, fluoride will have an effect, a higher effect. But the eating and the way that we graze today, we're always having a snack. Kids have their sippy cups, they're walking around eating candy. I mean, my kids, the teachers at school give them candy, their teachers at church give them candy, their coaches give them candy, everybody's giving them candy. And we're eating stuff all throughout the day. We're not eating 3 squares a day. It's breakfast, snack, lunch, snack, dinner, and then what do they call the midnight meal now at Taco Bell? And so you're never giving your mouth the chance to get that back to neutral. And so obviously fluoride is in the water isn't going to work. And we've been saying that for decades. But now public health is going to have to come out and figure something else, because I can't understand, and I've argued with the ADA and other dentists about this for decades, but the ADA and the FDA have hung their hat, and the CDC have hung their hat on fluoride as the only way to prevent tooth decay. Here in the United States, if you have a consumer product that is intended to treat or prevent tooth decay, it has to have fluoride. If it doesn't have fluoride, you can't make that claim.
Yep.
And the irony of that, when you really think about it, tooth decay is a bacterial infection of our mouth. It is an infection of strep mutans in our mouth. Fluoride doesn't address the infection. All fluoride does, if you believe everything they say, is it remineralizes your enamel and makes it less susceptible to decay. You see the logic there?
Yeah, or the lack of logic.
Lack of logic.
Yeah.
So
is part of the mechanism of action of xylitol, does it alter the pH, and what does it do to the oral microbiome, right? Because for anyone listening who doesn't know, you have healthy bacteria in your mouth. It's a different profile than what we would see, say, in your large intestine or your colon. So what does xylitol do in addition to preventing microbial adherence to tissue?
Well, there's a lot of bacteria that can metabolize xylitol. The ones that can't are the ones that create acid. And so you're selectively killing off the ones that create acid. You get rid of the strep mutans. And the reason is they try to eat the sugar. They can't metabolize it. They kick it back out of the cell. And it takes a lot of energy to kick that back out of the cell. They eat it again. And you end up starving that bacteria to death.
So they take it in as a putative energy source, but they can't metabolize it for energy, and they spit it out, and that process costs them energy, so they deplete
a lot of energy
metabolism. Is that correct?
That is correct.
Right.
And if you go look at the belly sugar studies, this is the best example of this. They had these kids chew xylitol gum, one in the morning, one in the afternoon, and one or at school. one when they got there, one after lunch, and one before they went home. And the kids that chewed the xylitol gum had a negative incidence of tooth decay, which means some of the little cavities had actually healed up. But the biggest surprise of that study was the University of Washington. This was the University of Michigan Dental School that went down and did it. And 8 years later, the University of Washington Dental School went back and did a follow-up. And the kids that had used the xylitol gum for that 2-year study period still had over 75% fewer cavities. 8 years later, where they aren't using it.
So when they're not using it, so I would imagine what that means is that it established a favorable oral microbiome that continued the effects of being, anti-cavity, so to speak.
And that is correct.
Yeah. And so you said something earlier about like the original dental research, the kids who chewed xylitol gum had fewer upper respiratory infections. And I would imagine that would be like nasopharyngeal, sinus, and would you include ear infections in that as well?
Well, the ones they're counting specifically were ear infections.
They were okay. So the question that I imagine some people are asking, well, how does something in your mouth affect your inner ear or compartment, or how does it affect your sinus compartment?
Ear infections, a lot of people think they get in through your ear, but they don't. They get in through the eustachian tube, which is in the back of your throat.
Yeah. So these airways, these pipes, basically are all continuous. So you can get bacteria that seeds either through the nostrils into the sinus cavity or through the mouth to the back, and then it basically goes upwards and gets distributed, right?
Correct.
And so
xylitol is just helping clean that out.
Yeah, and so it seems to me that if I could use the analogy of like seeding ground, if you have infections that are seeded in the nasopharyngeal environment, but you can change that. It seems to me that the xylitol as an upper respiratory strategy is leveraging the fact that most of these organisms are housed in that nasopharyngeal compartment. Is that your understanding of the mechanism and what's in the literature?
Yes, that's part of it. So xylitol in the upper airway works in actually surprisingly a number of ways. The first one is we've already discussed. It binds up and blocks the ability of a lot of these pathogens to adhere.
Right.
Okay, that's the number one. The second one is, and these are studies, they're all on our webpage if you guys want to go and read them. I mean, they're not, but there's links to them on our webpage. This was a study that was done by a dentist. His name's Dr. Stephen Olmos. He's down out of San Diego. But he used ultrasound and measured the airway volume. And then he had them use our nasal spray. And in 3 minutes, he measured the airway volume again. And in 3 minutes, their airway volume had improved by 20%. Okay.
Now, is that because there was if, for example, the nasal membranes, mucous membranes were swollen, they enlarge, which reduces the air passage, the volume of the passage itself. Is that what the issue is?
Yes, but what it did is it actually reduced that swelling. That it reduced that inflammation.
I'm sorry. That's what I meant to say. If I misspoke, my apologies.
Okay. Yeah, but so it was inflamed, and what's happening is because we use an 11% solution of xylitol, osmotically, it is going to pull that moisture out of the tissue and reduce that inflammation.
Right.
Okay, so it opens the airway. The other thing that it does is it actually speeds up the mucociliary clearance cycle. Mm-hmm. And the faster you get all that mucus cleaned out with pathogens, allergens, bacteria, you name it, then the less there is a chance that it's going to affect you. The less the chance that you're going to get sick.
Yeah. So just to put this in context, like a lot of the people that have listened to my podcast for the last couple of years and any practitioners, like we end up talking about the gut and mucosal immunology a lot and how the immune system's embedded in that mucus lining of the GI system. Well, the same thing occurs in the sinuses and in the nasopharyngeal space. And you use the term the nasociliary mechanism. This is basically a bunch of little finger-like projections, little tiny hairs that wave back and forth that actually create almost like a brushing motion to keep debris from accumulating so you can expel it and get rid of it, right? So you're saying that xylitol improves that functionality.
Correct.
Do you know this, that like the biochemistry behind that? I seem to remember something, and I actually wanted to ask this question about the oral microbiome as well. That I seem to remember something about nitric oxide being involved in that process in the nasociliary movement.
Um, I don't know the biochemistry of it. I do know that you brought up nitric oxide, but I do know that there have been a couple of studies where they used saline and
Mm-hmm.
xylitol and compared them, and the people that used xylitol had significantly more nitric oxide in their airway.
Okay.
I
Yeah,
that
which
I don't know the biochemistry of it.
yeah, so then that kind of brings up in fact on the podcast sometime last year I interviewed Dr. Nathan Bryan, who's one of the top researchers in nitric oxide, and we
Well, he's
talked
got a
about
great name. He's got to be a smart guy.
oh there yeah there you go. So anyways, he was talking about how roughly 50% of the nitric oxide that we have in our bodies are produced in the mouth by bacteria as part of the oral microbiome that take the
Yes,
dietary nitrates and convert them into nitrites, and then we swallow that and convert that to nitric oxide. So one of the questions I was going to ask, if you're prepared or equipped to answer that, was, do we have any studies? I could not find them. Doesn't mean they're not there, but do we have any studies, to your knowledge, that look at the use of any of your products and the increase in systemic nitric oxide, not just in the mouth or in the saliva or in the airway, but system wide, because those two systems are linked.
you know what? I am not aware of one, but let me grab a pen
Yeah,
because I that's actually an interesting. I'm going to grab a paper from over here. Sorry.
that's okay.
I'm actually going to write that down,
Yeah,
and
if you want
I
to
will.
kind of frame out the context, like look up the oral production pathway for nitric oxide.
Yeah,
And there's a handful of bacteria that are part of the healthy microbiome in the mouth that contain enzymes that we as humans don't have, right? So we rely on these mouth-based bacteria to take nitrates from our diet, convert that to nitrite. We swallow that, and then our gut starts to make nitric oxide. That's one of two production routes in the system that would theoretically affect systemic nitric oxide production.
correct.
Yeah,
I do. I know just barely enough to be dangerous about nitric oxide.
me too.
But what I also know is that the bacteria that help us digest gluten and
Mhm.
milk are also are in our mouth.
Yeah.
And when we use a mouthwash that kills 99.9% of bacteria, all you're doing is killing off all of those commensals, the good bacteria. Because even if you have someone that has a very high incidence of cavities, probably no more than 15 to 20% of the bacteria in their mouth are ones that cause cavities or ones that are
Mhm.
creating acid. The rest of them are the ones that are helping us digest our food.
Yeah.
So if you're using something that kills 99.9%, you probably should stop because you're killing your nitrous producers. You're killing
Yeah.
your commensals that help you digest milk and gluten and other foods.
So, and that brings up something else, is like you don't have only nasal sprays and xylitol mints. You have a xylitol-based gum, which I would assume is fluoride free. Um,
Correct.
and so where along the way, like maybe we can go back to the origin story of the company, because I know your dad was making xylitol I think products. I think you at one of your podcasts or interviews you called it jungle juice, or he called it jungle juice. But then, like now you're in a situation where you have, five or six different products to my count. You have different versions of nasal sprays. You have xylitol gum and mints, and you have, the toothpaste. So where along the way did you start back on like, we're really onto something here? We need to start broadening our product offering to fill holes based on the mechanisms of what we know xylitol can do over here and over here and over here. What was that what process did you go through to get to that?
So we started with the nasal spray. I mean, obviously that's what my dad had invented. That was what my dad had a patent on. We started with that. Within literally months, we had customers of ours asking us why we weren't selling xylitol gum, because many of the people in the natural product space already knew about gum with xylitol and how it prevented tooth decay.
Yeah.
So we actually started buying gum and reselling it. Within, I want to say, 2 years, we were one of the largest xylitol gum companies in the country. I mean, we were the biggest one in the country. We were one of the biggest xylitol gum manufacturers, or sellers on the planet. And we were the largest one that was selling a gum that was 100% xylitol. Hmm. There's other ones out there that are selling gum with 2 or 3% xylitol. I mean, like Trident, they advertise with xylitol in their packaging, but there's an ineffective amount of it in there. They're just not going to do you any good. Yeah. You want to make sure that it's either the first ingredient or preferably the only sweetener in there. And so we got into the gum, and shortly after that, we had people asking us about toothpaste. And so we started making toothpaste and mouthwash and mints. Some of the products that we've come out with that we don't currently sell is we actually came out with a dental probiotic. And we came out with that about 15 years ago, 14 years ago. And it didn't sell. The idea, and what we actually had, is we put it into a pixie stick. And I had it, and I gave it to my kids, and they loved it, because at night after they brushed their teeth, I would have, I'd sit in bed and read with them, and they would get to eat their candy, this pixie stick, but it had xylitol, it had non-ascorbic or calcium ascorbate, which is a non-acidic vitamin C. It had vitamin D. It had, I'm trying to remember what else it had, but it was in essence a probiotic pixie stick. With all the vitamins, calcium glycerophosphate, everything they needed for a healthy mouth, et cetera, et cetera. But it didn't really sell. It really didn't take off. We're looking to reintroduce that now, because we think that today, 15 years later, people have a better understanding of the importance of a good commensal microbiome in your mouth.
Yeah. Yeah. When I had that conversation with Dr. Bryan, I asked him whether or not he and his company were trying to come up with an oral microbiome that was geared towards producing more nitric oxide. And he said, well, we kind of tried. There's some challenges there. There is one company I'm aware of called Research Nutritionals. They don't make products like yours, but they just in the last year came out with a product for the oral microbiome. Off the top of my head, I don't know if it's xylitol based or if it's botanical based or a combination of those things.
Well, I will include that in some of the stuff that we're looking at.
Yeah. This is why, like, honestly, I'd love to have conversations with people like you, because you're clearly creative and entrepreneurial, and you're trying to bridge the gap between, like, it's not like you just came up with an idea and say, hey, let's make gum with this, and we think it's going to sell. Like, you're looking at, number one, your father's initial experience in his own practice, and that was based off dental research. And then you've been paying attention to, and I would assume you guys have an internal process where you look at what the literature is saying and identify problems that either lay people are struggling with, or maybe even clinicians like me, and then trying to come up with solutions, like how do we use xylitol or other ingredients to fix or help people fix these problems. Are you, like, on your team, are you largely responsible for innovation, or are you just steering the ship and you have other people that are responsible for that?
Both, I guess. No, we have a number of doctors and a number of dentists and hygienists that we collaborate with, that we converse with and discuss research, discuss product ideas, discuss ideas for research. But at the end of the day, um, I'm the one that ends up making those decisions.
Right. Right.
So I mean, we had a one, and I'll this is not something. This is something that's still being researched and published, I want to say, and we're helping to fund it. We're never going to make any money. We're not going to put a product out there, but there's some research that just got published, or maybe it's just getting published, where some doctors at Northwestern went and took some humanized rats and humanized lab rats and
Mm.
gave them cancerous tumors, and then they used xylitol and showed that that could actually get rid of the tumors.
Mm. I
And
would
it's
imagine. I'm sorry to interrupt, but I'm just thinking. Like I know that, for example, certain tumors and cancers don't respond well to, say, ketogenic diets, which is all about changing energy metabolism, right? And it seems to me, based on what you've explained before about these, organisms not being able to metabolize xylitol as an energy source, is that the proposed mechanism as why that might kill cancer?
that is correct,
Yeah.
because if you're starving it, it can't grow. And so the tumors, and where this came from was a conversation, and we were actually just discussing the similarities between strep mutans eating, strep mutans, it's a mutant. It mutated away from the normal one, and it mutated to eat that six carbon sugar, and it doesn't actually metabolize it fully, which is why you have acid. And that is actually kind of very similar to what cancer tissue does with six carbon sugars. I would think that every oncologist, the minute you have a patient that comes in and says, "Yeah, I have cancer," the very first thing they should do is take you off carbohydrates.
Well, there
But
are some doctors that suggest that. Yeah.
there are some, but it isn't.
Yeah.
That's not common.
No, it's not
But
standard
it
of
should
care.
be.
That's for sure. Yeah.
Yeah, standard of care.
Yeah.
That's what I meant.
Yeah.
But you have doctors, like, I don't know if you know who Otto Warburg was, but he was a cancer
Mhm.
researcher in Germany prior to World War II. And he actually pointed out that his thought was that a lot of cancer was actually caused by fructose.
Mm. Yeah, I've heard that theory. Yeah.
So, and he was an openly gay Jewish person living in Berlin, and he refused to leave. And the Nazi Party valued the research that he was doing enough that they kept him alive and
Mm.
with a lab throughout the war.
Wow. That speaks volumes in and of itself.
Yeah.
Yeah.
So,
So
anyways,
I have a question. Like I've done, before you and I jumped on the call today. I was kind of trying to look at some of the more recent research, and a lot of times in the world of natural medicine, we learn one thing about something, like in your case, xylitol, and we say, okay, xylitol reduces dental and sinus or upper respiratory infections. But if you look at the literature, it's also a biofilm disruptor, which might be important in cases of irritable bowel syndrome or other dysbiotic or gut-based conditions.
well, hang on. Earlier, you mentioned that you used our nasal spray
Yeah,
for a certain kind of patient,
yeah,
ones that had recurrent sinus
yeah.
infections
Recurrent
or
sinus
recurrent.
infections. Yeah, and
So
these were
there's there.
confirmed by these were confirmed by nasal cultures, not just I think you have a sinus infection.
There are articles in the medical literature about that. That if people have chronic or recurrent ear infections or sinus infections or upper respiratory issues of almost any kind, chances are pretty high that there is a biofilm involved in that. And yes, xylitol does wipe out the biofilm.
But it seems to, like, we also know, I think in the early days when biofilm research came on our radar, we thought of biofilm as kind of like an exclusively bad thing that was only used and harnessed by potential pathogenic organisms. But we know now, like, the part of the microbiome is housed within biofilm as well. So does it seem to be maybe a unique characteristic of xylitol that while it can break the biofilm, it exerts most of its impact on potential pathogens or true pathogens and leaves the microbiome alone?
Well, it depends on what's in the microbiome, because it's not going to affect the microbiome in and of itself. It affects the bacteria in it. So when you have, let's say, strep mutans in a microbiome, you're protecting the microbiome. That matrix is protecting the bacteria in it,
Right.
and that excludes, it keeps out anything that they perceive as harmful. Well, they strep mutans, they get sugar. They pull the xylitol into it, and they start eating it and metabolizing it the same as if they were planktonic. And they start eating it. And the only reason why it breaks up that biofilm is because if you get enough of the pathogens in there that are eating it and dying off, the whole biofilm matrix will fall apart.
Will start
So
to fall apart.
yeah, it only is going to affect the same bacteria that it affects that are planktonic, that aren't in a biofilm.
Right.
Does that make sense? So if
No,
you have
absolutely.
bacteria that can metabolize xylitol and you have a healthy biofilm, it's not going to do anything to it.
Yeah. Some of the other research, and this is linked to probiotic species, is that I've seen literature that talks about xylitol, and this would be consumed orally, right? Not just something that you swish around in your mouth, but I would imagine in the higher doses that it also helps to improve the production of short chain fatty acids, like things like butyrate and propionate, which can be used to reduce intestinal inflammation in a whole bunch of different things. Um, have you guys played around with not an oral product in the sense that it stays in your mouth, but something that gets ingested? And do you have any ideas or plans of going into GI health as opposed to simply mouth health?
Well, respiratory and oral health is where we're at. We have not. We've considered it. Right now, we're spending most of our excess cash on legal bills and fighting our government. And so our innovation is kind of have slowed down a little bit.
Sure.
But there is a study. Again, this was done by the same guy at Northwestern University, where they use xylitol and erythritol to treat people with C. diff infections.
Mm-hmm.
And what they showed is that you can treat a C. diff infection with just having a drink with xylitol and erythritol in it a couple of times.
And that's obviously below the threshold that would cause like GI upset, because I know that these things,
absolutely,
these sugar alcohols are slowly metabolized. They can pull a ton of fluid into the intestinal system and cause what we commonly call disaster pants.
Let me clarify that, because if you have a C. diff infection, I think you're already well beyond that.
Yeah, true. True.
Yes. And as far as that dirty pants thing, the xylitol and erythritol that we utilize in our products, mostly xylitol, but we do use a little erythritol, they are not nearly as laxative as your sorbitol and your mannitol and your maltitol. Those ones are a much bigger issue. In fact, if you want to read, I don't know if I should say this on a civilized podcast, but if you want to read some of the funniest stuff you'll ever read online, go on Amazon and read some of the Haribo sugar-free gummy bear reviews. They are to die for. Like, you will laugh to tears.
Yeah, just the anecdotal, the stories, right?
Oh yes, and they're so hilarious.
You mentioned that some of your products have erythritol in it, which is not an uncommon natural sweetener for coffee and different beverages. Even some hard products that whether it's protein bars or sports bars. To your knowledge, does erythritol have some of the same properties that xylitol does in terms of blocking pathogen adherence or changing viral replication rates?
So that's an interesting question, and my belief is yes, but there's not as much studies, there's not as much data to back that up. But going back to our legal conundrum with our very great and very glorious government, and in their infinite wisdom, but they actually pushed us to do a study. So I mentioned earlier the study that was done at the University of Tennessee that showed that xylitol blocked the ability of the SARS-CoV-2 virus to adhere to tissue. That was done on barrel kidney monkey tissue, which that's the industry standard for the pharmaceutical industry. And the FTC came to us and they said, we gave them the data and they said, no, you can't use that. It's not in your nose. It's not human airway tissue. We're like, okay, so it's the standard for the pharmaceutical industry. Well, no, you have to do another study. So we actually went and did another study and we got some human airway tissue and we looked at erythritol because it's a 4-carbon sugar. We looked at xylitol as a 5-carbon sugar and we used sorbitol as a 6-carbon sugar. And we looked at which ones do we look at? We looked at SARS-CoV-2, we looked at H1N1, we looked at RSV, we looked at rhinovirus, we looked at adenovirus, we looked at MERS. I mean, we looked at a bunch of these viruses. And yes, erythritol does block some of those better than xylitol does and better than sorbitol does. The one that they all effectively blocked is SARS-CoV-2, which is crazy. And it goes back to what I said earlier. SARS-CoV-2 is an incredibly simple pathogen to counter. You just have to do anything other than sit there and do nothing.
And do nothing, yeah. Which is, like you said, was what we were all told to do.
Yeah.
So let's talk about some of the specific products as we kind of danced around this a little bit. I've mentioned the sinus spray or the nasal spray that I've used personally as well as clinically. And I know that there's a nasal rinse, kind of like the a la the neti pot type strategy. And I've heard you on other interviews say, well, you don't really want to use the rinse all the time, but you certainly could use the nasal spray on a routine basis, either as a preventive or let's say as a therapeutic if you already have an infection. So why don't you talk to me just about the applications as you guys see it? And I understand that you're not giving medical recommendations or personal recommendations, but just general usage of some of your core products. Why don't you walk me through 2 or 3 of those?
So our products, first of all, the majority of our products, we do have 2 products that are drugs, that are classified as drugs, OTC pharmaceuticals. A fluoride toothpaste is one of them. Another one is our latest product line extension was actually putting oxymetazoline into a nasal spray so that all the people out there that are using, Afrin and all these other oxymetazoline-based sprays, they can get one that has the benefits of adding xylitol to it. And hopefully our goal is to get them off of the oxymetazoline, which is not that good for you, and using one with straight xylitol, which is
so
great
you look at that as a transitional product.
Absolutely,
like
100%.
Like a bridge product.
Correct. It's a product to get more people into the franchise, into the idea of nasal hygiene. And then the other one that we have is a high volume irrigation. It's just like a neti pot, but you squeeze it in one nose, it comes out the other. And a lot of doctors tell their patients to use that every day, twice a day.
Mm.
And we disagree with that philosophy. And I'll give a good example, a good comparison. This was a comparison that was not first put out by me. It was one that was put out by an ENT at George Washington University that actually did the studies to show this. But when people use nasal irrigation every day, twice a day, they're cleaning out the entire protective mucosal layer. And you need that protective mucosal layer. If you wash that out, it's going to take you, a couple hours to rebuild that, for your body to redo that. That whole time, the underlying tissue is exposed to pathogens and irritants. Okay. But what he compared it to is he said, yeah, you go back 100 years and doctors would tell women to use douches. And after 100 years of this, what did they find out?
Probably not a good idea.
It's not a good idea because you're killing all the resident commensals that you need. You're also flushing out all of the protective mucosal layer. So you're making yourself more prone to more infections. And he actually showed that if you take people who are using nasal irrigation and every day, twice a day, and you just have them stop, they go through about a 2-week period where it's not very comfortable. But after that, most of the symptoms just clear up.
And that's because they're regenerating that mucosal tissue, that mucosal layer.
Correct.
Yeah.
And his name, if you want to look up his papers, his name is Talal, Tlal, Nasuli, and Nsouli. And most of his papers, not most, but some of these papers, we have links to from our webpage. So
And
we
so the like
we
the I'm
go
sorry,
ahead.
no, please continue.
So we only encourage people to use the irrigation bottle sparingly as needed, or as their physician counsels them to. And what we advise people to do is to use the nasal spray. When you first start using it, use it 3 or 4 times a day, because you're trying to break up any biofilms. You're trying to, that are pathogenic. You're trying to clean, everything that's in your nostrils and your sinuses out. And then after that, once in the morning, once at night should be enough.
And so the routine use of the nasal spray, say twice a day, doesn't get you into the same place because I would imagine one of the big differences is the volume of liquid and the mechanical interaction, right? It's just the magnitude is much higher with a rinse than it is with
Oh
a
yeah,
spray. Is that what the issue is? Yeah.
that's correct. And when you use a spray, you're putting xylitol into the mucus, which is going to speed up the clearance of it, and it's also going to block pathogens.
Mm-hmm.
But at no point are you leaving the underlying tissue exposed.
Is there any direct antimicrobial activity? Like I know, for example, with SARS, the CoV-2, that it can inhibit viral replication, which is a key strategy to prevent infections from spreading inside the same host. Does xylitol do the same thing, either with just simple viral replication, or does it otherwise directly interact with microbes other than simple blocking the absorption?
Well, interesting you should say that. We don't really talk about it that much, but we do know that the grapefruit seed extract that we use in our product as a preservative, at the 0.2%, it actually destroys coronaviruses as effectively as a 70% solution of alcohol.
This is going back to something you were talking about, and I kind of missed the name of it, but it's a version of carrageenan.
Iota carrageenan.
Iota, is that iodinated? So it's got iodine in it? Is that
I
what it is?
I don't know enough about iota carrageenan to be able to answer
Nor
that
do I.
question.
Yeah. The
In
reason
fact,
why I asked that, the reason why I asked that is that my personal physician, makes me sound fancy. My personal physician, she has treated a lot of people with coronavirus infections over the years, and one of her staples is basically an iodine nasal lavage. So you get iodine, you dilute it to a certain percentage, and then you do the neti pot with that, within the first week or so of getting the infection. I think there's a window that if you don't grab it early, it's not effective. But I'm wondering if it is an iodinated carrageenan, if that's part of the efficacy.
you know what? I'll actually look that up.
Yeah.
Well, actually, I can answer that. No, I don't think it is then. And I'm just thinking this through. They weren't looking at virucidal activity. They were looking at how it blocked adhesion to the
Right.
tissue. And so it was blocking adhesion. It was not, well, so that's not even clear, because if you kill it all, it's not going to adhere anyways.
Yeah.
So I don't know 100%. What I do know is that xylitol, we actually did a virucidal analysis of xylitol, and it did nothing to the virus in terms of killing it. But the grapefruit seed extract did.
And in terms of preventing adherence to tissue, I would imagine that the structure of the xylitol molecule um, basically matched the shape or the conformation that's required to bind to the receptors on the infection itself.
On
In other
the
words,
ACE2 receptor sites.
so it blocks the ACE2 receptor is what it does,
Yes.
but without changing its activity, I would assume.
And it doesn't block it for very long.
I was
There was
going to
a
say
paper that
it
was
would have to be
published.
transient.
Yeah, it is transient.
Yeah.
There was a paper, and I'm trying to remember the journal it came out. And we actually, me and my dad and a couple other doctors actually got on the phone and chatted with the author, but he's in France, but he actually wrote a paper about how xylitol is blocking the SARS-CoV-2 virus from adhering to the tissue. And the way that it does it is it does bind up on that, but it is a very transient thing. So you have to keep the level of xylitol higher than nothing.
Right. Right. And do you think, like, and again, this is not treatment advice, but someone who was interested in stacking the odds in their favor, routinely using the nasal spray clear formula morning and night, and then at the first sign of, oh, I think I'm coming down with something, whether it's coronavirus or not, increasing the frequency of use for a period of several days. I mean, I'm, just thinking as a clinician now.
Well, so if you're using it, 3 times a day, once in the morning, once at night, your chances of getting COVID, according to the paper that was published out of India, you're going to reduce your chances by 70 to 80% of getting COVID to start with. If you ever did get COVID, I would continue to use it. That's just me. Again, I'm not giving medical advice.
Right.
But also, if I thought that I was getting sick with COVID, I would probably use one with iodine. Just use a nasal spray with iodine, because at that point, you're going to kill all of those viruses. Iodine will destroy the virus in seconds. The grapefruit seed extract that we use, it takes a couple of minutes to do it, so it's not killing it as fast.
Right. And so people who are using that, they need to stop themselves from immediately blowing their nose and clearing the science once they spray it up there. Right.
Yes, you want to spray it up there and let it sit there.
And let it sit. Yeah, that's exactly right. Yeah. So I want to respect your time, and I appreciate.
Let me add one other thing to that, because
absolutely
there are groups of physicians out there like the FLCCC, the Frontline Critical Care Coalition.
Oh yeah.
And they are actually, and I disagree with them on this, but they're the primary, they're the doctors. But I disagree with them telling people to use an iodine nasal spray on a regular basis as a preventative.
Right.
And they do tell people that. And the logic behind that is you're killing everything. And we know from your mouth, we know from your gut, that anytime you destroy your commensal microbiome, bad things happen.
Yeah.
And so if you use it, when you first get a tickle in the back of your throat, start using it for a day, 100% I'm on board with that. To go and destroy your commensal microbiome over and over and over and over on a daily basis, I think is a disaster waiting to happen.
Yeah, and I'll just mention Dr. Bryan again. When we did the interview with him, he's published work on, like he said to me quite literally, and this is a direct quote. He said, "When Listerine says it kills 99.9% of bacteria, you believe them." And so he published data where they measured oral microbiome and then had people use mouthwash for a week, and they basically destroyed their oral microbiome. The consequence in his world was that reduces nitric oxide, and that's not a good thing. So he's a huge advocate of not using things that kill all the bacteria, just like you're saying. If you were to, like, what's your favorite product of everything that you make? What's your favorite and why?
Probably the nasal spray. I mean, I brush my teeth with our toothpaste. I mean, I use our gum. I use them all, but the one that I probably would say is my favorite is going to be the nasal spray, for the simple reason that you can use toothpaste and you can chew gum, and you can logically see the long-term benefit that you're not going to get tooth decay. I mean, I haven't had any cavities in 25 years. I've been sick once in 25 years. But when you use the nasal spray, and if you've used it, then you're going to know what I'm saying. You can feel that it works. You feel a difference in minutes.
Yeah. Yeah.
So
and
that's why I like
versions, right? You have the nasal, just the clear and the clear max, I think it's called. Which is
we also have a clear rescue.
Okay. And what's the difference between those formulas?
So Xlear Max, when we, and this is 20 years ago, we started doing some research with our customers to find out what we could do to make a product line extension.
Yep.
And even though we were at that point 20 years ago still talking more about how it prevented and or was used to keep people from getting sick as a hygiene tool from bacterial illnesses, what we found out in that first time we went out and started talking with our customers is that the vast majority of our customers actually used it for allergies.
Hmm.
So we said, well, how do we make it better for people with allergies? And so we added capsaicin to it. Not a ton. You don't feel it. But capsaicin is just a natural low grade homeopathic antihistamine.
Mm-hmm.
And so if you know that every spring you're going to get, seasonal allergies, or every fall you're going to, then start using the Xlear Max during that time. And we don't believe that we're going to get everybody off all of the drugs, but our goal is to get people to use less pharmaceuticals.
Right. To be less dependent on that.
Yeah, we understand that there is a time and a place for pharmaceuticals, but we believe that in our society, in our culture, we go and we get a nuclear bomb of a pharmaceutical day one, because that's what we're trained to do, and that's
Right.
usually going to be detrimental to our health in the long run.
Right. Right.
And then the rescue product came about. I mentioned that I'd been sick once since 2000, and I had a sinus infection. I went to the doctor, and they said, "Yeah, you have a sinus infection." They gave me some antibiotics, right? They gave me a prescription for some antibiotics. On my way home, I called my dad and I said, "Dad, tell me why I'm taking a systemic antibiotic for a localized sinus infection." And my dad, he's a doctor, but he goes, "I don't know, because that's what we do." And I said, "Why don't I get an antibiotic and a nasal spray?" And he goes, "I don't know. Sounds like a good idea. Let
Yeah,
me call and
that
see if
makes
there are
sense.
any." And he called me back like half an hour, 45 minutes later, and he goes, "They don't make any nasal sprays that have antibiotics in them."
Yeah.
And so and right now I want to tell people, don't do this. I was entirely lucky. Please do not do this. But what I did is I took one of the capsules of amoxicillin and I poured it into a bottle of our nasal spray. I shook it up and I squirted it up my nose.
Yeah.
Well, the very next morning, my sinus infection was gone, 100%. It was just gone. And you figure out how much of that antibiotic I actually used because I was actually putting it where it needed to be.
Right.
The reason why I'm telling people not to do that is because amoxicillin and most antibiotics are incredibly unstable in water, which is why they're capsules. They're not usually in gels. They're not usually in liquid formulas. And, with kids, when you're giving it to them in a liquid formula, you mix it up and then you keep it refrigerated and you have to use it within a couple of days.
Yeah.
So had I used that again the next morning, I probably would have had a very negative side effect. So please don't do that.
What would you have expected for that to happen?
I can't remember what it is, but it's not. I remember I looked into it and we said, yeah, that's why they don't do it.
Oh. Don't try this at home, folks.
Yeah, don't try it at home. And because it's not stable. And there was something, it was a known side effect of antibiotic toxicity when it was when it was in water or something. I can't remember what it was. I mean, that was 15 years ago, 20 years ago ish. And then so we actually came up and we took a bunch of these essential oils that are antimicrobial and put them into a nasal spray.
And is that what the rescue is?
Yes.
Yeah. And that's, one of the other strategies that I've used with these chronic recurrent sinus infections is adding essential oils to some other carrier base, to be used as like a nasal mister. And that can be quite effective, although, what I found is that there's no one essential oil that's going to affect every infection the same way.
Correct. And we actually use Palearco, which is an antifungal. We use tea tree, eucalyptus. We use oregano, and I'm missing one. We're missing something else, and I can't remember what the other one was.
The rosemary.
That could be. It's but there's in there. So we have our Spanish, our Mexican food, and our Italian food. We know when they're making up those products out in the production area.
Yeah, that's interesting. Tell me, maybe.
And those products you can get. I mean, those products, the Xlear product line is available everywhere. And another one that is we're just barely getting it out is actually cough drops.
I saw that on the website. Yeah.
But think of this: most of the cough drops that are on the market, and all the natural cough drops that are on the market, are made with sugar. So if you have strep throat, or you have staph, or you have some other issue of your throat, and you're sucking on a sugared lozenge, what are you doing?
Yeah.
You're feeding it.
Infection. Yeah.
You're feeding it. And so we actually came up with the sugar-free. It's natural. It has xylitol. It helps get rid of some of those bacteria. So,
would you be able to put it into like a throat spray, like a xylitol version of something like Chloraseptic?
We do. We already have. We have one out there, but they use it for dry mouth, and it's a spray that works just like that.
Yeah. And so obviously you can repurpose that for just coating the back of the throat.
Yep.
Yeah.
Yep.
Why don't we do this? Because I would love to keep talking for as long as we could, but tell me an interesting story or anecdote from your dad's days. Is he still practicing?
No, he is now 88 years old. But no, he's not practicing. He lives in Texas. His wife is in assisted living center. So since that has happened, he hasn't really been traveling that much. He stays there. He visits. He goes over to her 4 or 5 hours a day.
When he first started making the original version of this, do you think he ever envisioned the company that you founded and you're running?
Yes and no. He was under the assumption, and it's an assumption that a lot of people have, especially people in healthcare, that if you build a better mousetrap, that the world will beat a path to your door. And it really isn't that way, because you can build, I'll go back and talk about xylitol, very general, but if we implemented xylitol gum chewing programs in our schools, it would cost about $25 per student per year.
Wow.
For those programs, and you would eradicate tooth decay, and you would reduce respiratory infections by 40%. That sounds like a no-brainer.
Very large percentage of why people go to the doctor is upper respiratory.
Yeah, it's by far the number one reason. Almost everything that you go to the doctor for as an illness starts in your upper airway. But public health won't implement xylitol gum chewing programs in schools. We don't know why. I mean, during COVID, we actually threw out a whole bunch of gum because it was getting short dated, because people weren't buying gum. They weren't standing at the cash registers in the grocery stores and buying the gum and the candy in the cash register. And we went to the state here in Utah, to the public health agencies, and I'm trying to remember Karen Hoffman, something. But we actually had a conversation. We said, we will donate the gum. You pick 2 schools where you spend more money on Medicaid children than all the other schools, and we'll hand out gum, and we'll see how it reduces the incidence of tooth decay and medical expenses over the year. And her answer was, well, who's going to pay for it the second year? Well, if you save that much money, then it kind of makes it a no-brainer that the state would pay for it moving forward. And she straight up told us and said, no, we won't do it, because we want to make sure that we have the money to pay the doctors and the dentists to come in and treat the kids, because we want to make sure they all have equal access to healthcare.
Wow.
And that, I guess, has become a code word for stop all of the prevention programs and let the kids get sick and get cavities so that we can put more money toward paying doctors to treat them.
Mm.
Because they wouldn't, even if we offered to let them do it for free the first year, because we were throwing it away.
Yeah. Yeah.
So how that
It's a
goes back to my
travesty.
dad is, my dad showed that by using a xylitol nasal spray, you cleaned up respiratory issues. You cleaned up. I mean, he had a lot of patients that had chronic allergies, and they start using it, and within a month or so, they're done with their going in and getting their shots. They're out on the basketball court. They're playing soccer. They're doing gymnastics. All of these other things that you would think people would want to do, but yet there's so many roadblocks that are being put in place by government agencies,
Right.
that you can't, nobody can beat a path to the door of whoever makes the best mousetrap.
Yeah.
There's too much money involved in people being sick.
Yeah. Yeah. And that's, I mean, in the world of natural medicine, we fight against these things all the time. And unfortunately, it's even more complicated because of the attitudes and the perspectives on health and wellness of the healthcare consumers, right? For most people. Now, I would say it's different now than 15, 20 years ago. But for most part, the average North American would rather simply, for example, take a pill than change their diet and their lifestyle, right?
Absolutely.
So
Absolutely.
kind of going back to, where how we led off with the whole discussion about bureaucracy and unqualified bureaucrats making decisions that affect healthcare policy, or what you can and can't say, or can and can't take. I wonder how much the personal opinions of these people making the decisions are coloring, even subconsciously, coloring the the requirements or the guidelines that they're putting in place.
I think that they're. I'm trying to think of how to say it nicely. I think that the opinions of the people at the FTC, which have zero basis in science or logic, have a lot to do with who they choose to go after and prosecute.
Yeah.
I mean, you don't see them going out and prosecuting um, big companies for saying that washing your nose would help with COVID.
Right.
They pick on little companies because they assume that little companies are going to roll over and and kowtow and stand in line and say yes sir, please, and walk away.
And it's easy to pad your victory record by going after people who maybe don't have the either the resilience or the resources for prolonged legal battle, because it's not cheap.
It's not cheap, and fighting the government, the way that the courts give deference to the government on practically everything. Fighting the government, people sit there and they say it's like David and Goliath, and it's not. It's like a infant baby, and you're fighting 10 Goliaths all on roid rage.
Yeah.
Because you can go in with a little company, a small company like our company, and yeah, we have to pay for these legal bills. The government, I'm paying for their legal bills too. I mean, they don't pay their own. They're not playing with their own money, and so it's an incentive not to. The other thing is that even if the government brings baseless lawsuits like this one, the employees, the staff, they never get reprimanded. They never lose any skin on, they don't get fired.
Yeah.
I mean, these people would have been there for 21 years. And I can tell you right there, if they'd been in private enterprise, they would have probably not had a job for longer than a year or two, because they were that cowardly. I don't want to say cowardly, but just the way that their demeanor was, that they would not have succeeded in private business.
Mm. Well, as we bring this to a close, where can people find your products? I know that they're used by healthcare practitioners like myself, and I have my own sources. But where can the average person find your stuff?
The average person can find this stuff, the nasal spray at CVS, Walgreens, Rite Aid, Target, Walmart, pretty much any grocery store or any pharmacy in the country. It's Xlear. It's spelled Xlear. The X is for xylitol, and it clears your nose. That's why where the name comes from. The spry dental products, oral care products, you have to go to like a health food store, like a vitamin shop or a Sprouts or a Fresh Time, something like that, a natural retailer, but they all have them.
Mm-hmm. And do you sell online as well?
Oh, of course, online. Everybody sells online. Yeah, you can find them on our webpage.
Amazon, and you can sell it off your webpage as well.
Yeah, they can buy it off of our webpage directly.
Yeah, we'll make sure that we put a link to your website in our
episode
description. Well, Nate Jones, I appreciate your time. I think you guys are doing good work, and I wish you well in your battle against those three-letter agencies.
Well, we will. Hopefully, we keep up the good fight, and hopefully, we push back on more of their unjust overreach and agency creep, which is what our goal is.
Yeah, and maybe once that comes to a head and gets resolved, maybe I can have you back and you can tell us the story and all the sordid details.
I look forward to it.
All right, Nate Jones, I appreciate it very much. Thank you very much, sir.
Thank you.
This podcast is for general informational and educational purposes only and does not constitute the practice of medicine in any form or capacity. No doctor-patient relationship is formed. The use of the information in this podcast or any materials associated with or linked to the podcast is at the listener's own risk. The content of this podcast is not intended to be a substitute for professional and personalized medical advice, diagnosis, or treatment, and listeners should not disregard or delay obtaining proper medical advice when a health condition exists and warrants that. And finally, functional medicine is not intended or designed to treat disease, but rather is a natural approach to support restoring health and wellness. The use of diet and lifestyle modifications and nutritional supplementation is supportive or adjunctive care.